My topic for inquiry and analysis is suicide intervention. This is for the class interview and counseling, and my name is Crystal Lynn Crowell. In order to truly understand suicide intervention, knowing the definition of suicide is extremely important. The medical definition of suicide is the act or an instance of taking one's own life voluntarily or intentionally, or a person who commits or tries to commit suicide. Also, to understand suicide intervention, understanding the warning signs of suicide is extremely important. So, observed signs of serious depression, increased alcohol or drug use, impulsive and taking unnecessary risks, threatening suicide, making a plan, or unexpected rage or anger. Also, giving away one's possessions can also be a sign of wanting to commit suicide. Someone who works in suicide intervention also needs to know the resources available for those in need. The National Suicide Prevention Hotline and Veterans Crisis Line are two very popular that are used. There are 5 action steps for helping someone in emotional pain. Step 1, ask. 2, keep them safe. 3, be there. 4, help them connect. And 5, stay connected. Step 1, asking. Are you thinking about killing yourself? This is not an easy question, but studies have shown that asking an individual who's at risk does not increase suicidal thoughts. Step 2, keep them safe. This is the idea of reducing someone's possibility of committing suicide. Getting rid of lethal items is an important part of suicide intervention and prevention. Asking an at-risk person what their plan is and removing or disabling any lethal means can make a huge difference. Step 3 is being there for them. Studies have proven that talking about suicide may in fact reduce rather than increase suicidal thoughts. Acknowledging and talking about it is another way of being there for someone, but listen to what the person is thinking and feeling. Step 4, help them connect. The National Suicide Prevention Lifeline's number is 1-800-273-8255. This can be an important part with a member that's not a professional. Help bring someone to a spiritual advisor or a mental health professional. Step 5, staying connected. Staying in touch with someone that was at risk or in a crisis situation can make a huge difference. Studies have proven that the number of suicide deaths goes down when someone follows up with an at-risk person. In the peer-reviewed article, I found that data synthesis, education of physicians, and restricting access to lethal means were found to prevent suicide. Other methods include public education and screening programs. In 2002 alone, an estimated 877,000 people committed suicide in the world. A comprehensive approach to suicide prevention is educating individuals on how to respond to crisis, identify and assess, how to increase help seeking, and how to post-vention. So that means discussing things after they go through treatment. School-based suicide intervention with children and adolescents are extremely important, especially where suicide is the third leading cause of death among youth ages 10 to 24 years of age. The Suicide Prevention Resource Center has come up with 5 keys to success. 1, engaging people with life experience, partnerships and collaboration, safe and effective messaging and reporting, culturally competent approaches, and evidence-based prevention. The overall idea of the 5 keys to prevention are engaging with people who have, in fact, experience with committing suicide / attempting to commit suicide, and looking at the facts on what has helped people prevent killing themselves in the past and what has not helped individuals from killing themselves in the past. In conclusion, suicide intervention is very important to understand, whether it be your employers, your school, your counselors. Everyone needs to be educated on the resources available in your area. With suicide intervention, the only limitations and implications when it comes to the practice of counseling is people not being educated on what suicide intervention looks like, what is needed to be successful at suicide intervention, and the resources available if someone appears to be suicidal.